Yeah, today we're talking about point-click care, which is, we'll talk a little bit about what that is and how it works with Janet and give you guys some examples and talk about how you might use it. So we're really excited to talk with you guys today. I'm really sad I can't see Andrew. Oh, well, okay. Yeah, but I can't see any of us, like my video went away. I'm going to try stopping sharing, and then I'm going to try sharing again. Nope. Okay. Might be it's a new feature in Zoom that I can't see the video once I share my screen. It's fine. Okay. Hi, Katie. Good to see you. Okay, guys. Wow, I'm very thrown off that I can't see you, Andrew. I'm sorry. But you guys are seeing, Crystal, you see my screen? Okay.
Yeah, I see you.
Okay. Okay, cool. All right, well, welcome everybody. We'll go ahead and get started. If you're just joining us, please go over to the chat and let us know where you're joining us from. We are so excited today to talk about point-click care as our Friday feature, which talking about how automating reports works, how that connects with Janet, how you can use it to improve services. So we always like to know where in the world you are. So I'm today here in Portland, Oregon, but yesterday I was in Minneapolis, Minnesota, and this week we were lucky enough to host a happy hour in downtown Minneapolis. I was there with Mike McRae from our team. We had a great time. Those of you who were there, yay, thanks for coming. It was so much fun, and Minneapolis is certainly beautiful this time of year, so I feel very lucky to have been there. But yeah, let us know where you are in the comments. So hi, Mary from Minnesota. Hi, Tegan from Virginia. We're glad you're all here. Hi, Melody. So quick introductions. I think most of you guys know me, but I'm Ginger Bandine. I'm the founder and CEO at Mission Driven Data. I have been doing this for the last 5 years, and before that, did quality improvement and compliance, and before that, I did social work. So I'm a social worker. But yeah, I love helping agencies think about how the data that you're collecting and have access to can improve the services and the lives of the folks you provide services to. So Andrew, do you want to say hi and introduce yourself?
Of course, yeah. Hi. I'm Andrew Sathan. I'm the Director of Product and Services at Mission Driven Data. And well, before that, to use Ginger's pattern, before that, I was the Chief Information Officer at a behavioral health agency here in Philadelphia. I'm in the Philadelphia area, so I'm representing the Eastern time zone today. And actually before that, this is a fun fact I've never shared in any of my introductions. Before that, I was a librarian. I worked in information technology and as a librarian at a law library in Philadelphia many years ago, different lifetime. So, fun fact.
But if you notice, Andrew still keeps things very organized.
Yes. Oh yes. Everything has a place, and if it doesn't have a place, its place is the trash. That's what my dad would say. And I am becoming my father the older I get.
That's awesome. Thanks, Andrew. Okay, really quick about Mission Driven Data, because I think most of you guys know who we are. We help agencies with their data. We specialize in getting data out of the credible EHR. We have a community. If you're not already a member of our community, Crystal will put the link to join in our chat. And then we also offer consulting to help agencies with figuring out how to use their EHR, how to use their data, and things like that. So you're in the right place today. If your agency currently uses point-click care for some purposes and you're curious how you could do more with that, you're also in the right place if you use something different for hospital and emergency department notifications, and you're just interested in how you could adapt something like what we're doing to your own system. Or also maybe you're here today because your payers or community partners are starting to talk about hospital metrics like hospital follow-up, readmission rates, things like that as part of maybe value-based payment or other types of grants or programs you're a part of. And maybe you're starting to think about how to improve on those metrics. Or maybe you're trying to be proactive and you expect that that's coming someday and you're just trying to like get ahead of the curve, in which case kudos to you. Sorry, just a sec here. Okay, so our agenda for today, we're going to talk about a little bit about point-click care and how agencies use that, how to access the data and reporting options that are available, at least to some agencies, and then some examples and applications of data tools that are possible when you can get that data from point-click care, and especially when you can connect it to your EHR data. We are recording today's session, so you can relax and absorb information. Please ask questions as we go. We're happy to email out the slides today afterward too, so you'll have access to that as well. Yeah, please ask questions as we go. One of the things we're going to be talking about is how point-click care is maybe slightly different depending on what state you're in, and also depending on what your relationship is with point-click care. So if you have a specific question or you're thinking about it, don't be embarrassed, just ask. We are happy to think about how to answer it. I just realized that in this picture, this looks like 2 eyes. It looks like a little face on the left-hand side. Can you tell I've been traveling a lot? It looks like a cute little face. Okay, moving on. Okay, we want to start with a quick poll. I'm going to go ahead and launch that. So our questions are, does your agency currently get information from an information exchange like point-click care? So in some states, this point-click care is sometimes called like collective medical or pre-manage or ED or EDI or EDIE or lots of different names. So it's, and you might have something else where you're getting information from your hospitals, but that's our first question. And then if you are getting that information, what do you use that information for? So do you use that for real-time care coordination? Do you use it to communicate crisis plans to the emergency department in case someone goes to the hospital? Do you use it to look at trends over time? Do you use it to find people you might have missed and follow up after discharge? Or do you use it for something else? And if it's something else, let us know in the chat. And then what factors are involved in your efforts to coordinate care with acute care providers? So this is kind of like, what's the relationship you have with those providers and how does that work? So do you have like a contractual requirement to coordinate care, or do follow-up services, like say with your local hospital? Do you get incentives for performance on metrics related to the hospital? You just see the impact of coordination for improved outcomes for your clients, and that's why you're doing this? Or have you maybe like made a commitment to your community partners to be involved, or something else? You could also let us know in the chat. So yeah, thanks everybody for filling this out. It's just helpful to know like, why are you here and kind of what are you thinking? Looks like most of the people who are here do get information from something like point-click care, from some kind of information exchange. And most people are using that for real-time care coordination, to look at trends over the time, to find people you might have missed, and sometimes to communicate crisis plans. And then most people answered that they see the impact of care coordination on improved outcomes. And then a few people also have the contractual requirements, the incentives, or a commitment to a community partner. So cool. Thanks everybody for filling that out. It's so helpful. I'm going to go ahead and end that. Okay. So we're going to do our best to share a little bit of background about point-click care, but having traveled a lot and talked to folks in lots of different states, I will say that point-click care, which has gone by many names, there's certainly a little bit of like the story about how point-click care got implemented in different states might depend on who you ask in that state. So I've definitely heard people talk about these different methods by which it got adopted. So in some states, at least this one I definitely have heard like firsthand, that like in Oregon, the way point-click care got adopted was that the hospital association purchased a subscription to it, and that this was back in Oregon, at least during like the height of the opioid epidemic. And it was originally, now this is where I'm probably straying into things I didn't hear firsthand, but my understanding was that it was originally purchased because hospital emergency departments were really worried about overprescribing. So like they were really worried about people who would go to one ER and get a prescription for something, and then go to another ER and get the same prescription or a similar prescription for the same thing. And people would end up overdosing because they got prescriptions from multiple ERs. So that was something that back during the, like, again, at the peak of the opioid epidemic, or I guess I feel weird saying that because I know we're still in the opioid epidemic, but that the Hospital Association in Oregon decided it was worth investing in something where they could all communicate with each other and know if someone had just been in another emergency department. And then over time, that got expanded, at least in Oregon, to where that notification expanded beyond just hospital to hospital stuff, and it included like community agencies. And I think that started also with like long-term care like nursing home kind of places. And then it expanded to like community providers like behavioral health. And then the second part of that was that there was also a way then that like community partners could feed information into point-click care that would be sometimes then available to the emergency department through like, so that like a community partner could put in like a crisis plan for someone. And then if that person showed up at the emergency department, the person at the emergency department would have access to that information from that crisis plan. So it sort of became more of a two-way street in a way, not just like notifications, but also information back in. So that's the one I know about in Oregon. I've definitely heard recently of another state where the whole state purchased point-click care for their state. And I've also heard of county or regional organizations doing that, and also managed care organizations. So, and also it might be that like, even in Oregon, I think, now that I say that out loud, like I think the Hospital Association bought the original thing, but then some of the managed care organizations added on some of the features that allowed community agencies to engage. And then I think a person could technically like buy it as an agency as well, although I have not run into anyone who's done it that way. I think the price point is a little high for most of the agencies we work with. I'm curious of the folks who are here, because I know several states are represented. Does anyone have a different story of how point-click care got implemented, or how they've heard about it, or something you would add to those? Because again, we're kind of working off of multiple points of information. So please, if you know of a different thing, please feel free to put it in the chat. I'd be very curious. Oh, I know, sorry, I just thought of another one, which was in one state, like they had a different system for emergency department notifications, and they like switched that to point-click care. So it didn't used to be point-click care, but they had a system. And then the key components of point-click care, or probably most of these systems, is that there's some kind of web-based portal, there's push notifications, and there's probably scheduled reports. And then some of these, like I said, have a way for agencies to also feed in information. Potentially like upload information. Usually that's more like a client list. Usually for things like crisis plans, it's not like a bulk upload. It's like more like individual crisis plans can get added. But yeah, any other things people want to add to that? Andrew, is there anything you would add to that background?
Oh my gosh, you know so much more than I do. I know much more about the nuts and bolts of how to get the data. I'm actually learning things as you talk. So,
well, hopefully it's things that are not wrong. That these are, you know, since I'm from Oregon, I was involved in committees that were implementing point-click care back before it was called point-click care. So I kind of, some of this knowledge is from then. But yeah, I mean, the whole idea behind it is to improve communication, right? But when people are in acute care settings, inpatient or emergency departments, like how can you get the most important information to translate back and forth between those settings and community partners, I think. But although maybe originally it was all just within the hospital systems. Okay, so you have all this stuff, there's all this data in there, you get some of the data back out depending on what your relationship is. Oh, that's what I wanted to say about this. So what we're still exploring is in different states where the relationships are different. So some states, because of the entity that purchased point-click care, then the agencies themselves possibly have access to different tools depending on what thing was like purchased by their umbrella organization. And they may or may not have access to all the features. We don't know yet. We haven't thoroughly, like we haven't worked in every state that has this to know how much variation there is. Is that fair to say, Andrew?
that is fair to say, though. What I would add is like there's a lot of complexity in what we're communicating so far, and I would not let any of that dissuade anyone from trying, because I think that really like we've really simplified it. We've simplified it as much as we can on our end, and we're about to get into that. But when it comes to, if you aren't sure, like you don't know how your agency gets point-click care, you don't know how how that relationship works, or you think you know and you think you don't have access to this, like don't not try because you think. Like, just make sure, because it really is only going to take a couple of emails, and we scripted it for you.
Yes.
We made it easy for you to try. So if you've already thought, oh gosh, this is too complicated, please tune back in, because there actually is it is possible that you have more access than you think.
Yeah, sorry, I didn't mean to make it sound complicated. That was my bad. Yeah, basically there's this entity that has data that might be about your clients, and let's try to help you get it.
Yes.
Yeah. Sorry about that. Okay, so yes, as Andrew said, what we have tried and successfully done in more than one state now, right, Andrew?
Yes. Yep.
Is that you basically just send an email to the person who it would be your customer success manager at Point Click Care. And we give you this script of the email you could send to them. And this tells them exactly the words they need to hear to turn on the thing that would make it so we can help you get your data. So as you can see, it's very clear. You can copy us on this email. And I didn't put this in the slide because the slides might get sent out and I felt a little bit bad, but if you're working with us, we can, as you can see, I like grayed out the names of these people because we have some names of people at Point Click Care who are like the people who know what they're doing with this type of project. So we can give you those names if you're working with us so that you can like mention them too. So that like, if the person getting this email is like, I've never heard of this, I don't have any idea what it is, then we can help you. We can help connect them to the right person who can get that opened up for you. So basically the steps for getting your data out of Point Click Care are you send this email and we get connected into that email string. And then what happens then, Andrew? I have a slide that shows it in a very fancy way, but what actually happens?
I like that. That's great visualization. Yeah, so well, first off, I'll say like I in the past slide it said, CC us. Ginger, you said verbally you could CC us. I'm just gonna say I really encourage you to CC us, right? Like CC your solutions consultant because even if you Point Click Care is a Hydra, right? There are a lot of different people you might end up, your customer success manager might be different than the groups of folks we've been working with. So if you CC us, we will be able to redirect when they have questions. So I would encourage you to do that, please. And they will have questions, I'm sure. Really, it's a fast response from us to redirect them where they need to go. But yeah, so how does it work? What happens is, if you have any sort of report that you're manually pulling from Point Click Care, like you log into the portal, maybe you have someone assigned every day to do this thing where you log in and you run something. There is a solid chance that because you have access to that, you also have access to automating that report. And that automation won't be available to you in the portal that you're logging into. It won't be available to you from Point Click Care, like when you actually log in and do the thing that you would normally do to pull your data. However, Point Click Care has the ability to automatically pull that data, that report for you at a certain time of day, every day, and then send it somewhere. And typically they want to send it to what's called just an FTP server, an SFTP server. That's an acronym that if you know, great. And if you don't need to really know it because at the end of the day, like we can be that server. So if you're a Janus subscriber, it's already part of your subscription for us to provide this to you when there is someone who has information that needs this kind of thing. And so we would flip the switch, turn it on, and we would start receiving pushed data from Point Click Care. There is a reverse process that could happen, which is that they say, we're not going to push it to you. Instead, like, we want you to go get it. And then they're just going to give us like some secret information. They'll probably give it to you, and then you would pass it on to us, some secret information, a username and a password, and a place to go. And we will have software that can go and get the information, grab it, and then bring it down to our infrastructure where we can process it and turn it into data that shows up in Power BI.
Andrew, do you have a sense of how often that data gets refreshed in their report?
Yes, through the implementations we've done, it sounds like it's daily. It sounds like there might be wiggle room depending on who you talk to, right? Like what your relationship is. But it doesn't sound like they like to do it more than daily. There is also wiggle room in terms of what time of day that happens. And that actually is important to you, that actually is important because if you're specifically pulling ER, ED events, you probably want to pull it maybe before your day starts, right? So that you can pull in that data. You don't want to maybe pull it in the middle of the day and then miss out on several hours worth of ER, ED admits. So there actually are like thoughts. There's some. It's good that there's some flexibility about the time of day that happens, and that is probably the thing that you can tweak the most. I feel like there might be some wiggle room, like I said, with the frequency, but so far we've only ever done it once a day.
Cool. Thanks, Andrew. So there's this data, the data gets either pushed or pulled into into basically like in the case of people working with Janet, into their like Janet Cloud infrastructure, right?
That's right. Yeah.
And then how does that work with credible data?
Yeah. It we've built this system in a way where we can customize it pretty easily for your agency because every agency does this a little differently. But if it happens that your agency tracks somehow an ID that Point Click Care has access to. Maybe that's like a CMS, like a Medicaid ID. Maybe you send Point Click Care already like a list of your clients with your IDs and they send it right back. Like Point Click Care has a bunch of different ways of that they give you already to try to link up or uniquely identify clients in their system with clients in Credible. So depending on how you do that, and like I said, like we built this to be as flexible as possible, so we can pretty easily accommodate however, whatever method that you use or Point Click Care makes available to you. We will automatically cross-reference data. So we can automatically say like, hey, like, I see that Point Click Care's, unique ID is this, and I see you have that ID in this client record in the external ID, let's say, or maybe you have a custom field that you created called Point Click Care ID. It changes state to state, right? What you might even call it. And so we can do whichever one of those things you want, and automatically bring in the data because we know that person is the same person. We do have like a fuzzy match that we can go into. Do you want me to talk about that too, Ginger, or do you want to
Yeah,
talk?
because it's all the cool things. Yeah, Andrew
Yeah,
figured out how to
yeah.
do a fuzzy match. Also, I can
Yeah.
see you now, so now I'm going to be
Oh,
able
that's
to.
good. I'm glad. Yeah. So then there's another way that if it happens that you don't have that way, like Point Click Care doesn't give you anything or doesn't know anything about your clients, and you're just getting just a fire hose of data, or if it happens that Point Click Care does give you those IDs, but you're in the position where maybe you are getting, say, Medicaid IDs, and somebody is behind on entering those into Credible, right? So then that person doesn't actually have Medicaid ID in Credible, but they do in Point Click Care. We do something called fuzzy matching, where we will automatically match up records of your Credible clients and Point Click Care clients based off of name and date of birth. So if their at least their name and their date of birth match, then we will fuzzy match it. And so technically you don't really need any connector at all to get some data. We can just fuzzy match them based on name and date of birth. We can put in a little warning for you so that if it does happen, you know that this is a fuzzy match, so we're pretty sure, but technically there could be two ginger bandines born on the same, date. But so we kind of flag that for you so but it's a way of you getting access to the data, especially like pertinent data, like, emergent data like ER and ED visits, without having to wait on like a clerical or administrative task, or data entry task on your own side to catch up, say, with client information.
Yeah, and how I've seen agencies do this when they don't have this kind of system working is that they like have someone's job be to go look at Point Click Care every morning. They go look up those clients in Credible, and then they maybe like add a client visit and fill out a form that says this client on this day, was in the hospital. Which, there, I think some agencies might still feel like there's a good reason to do that, but I think we're trying to solve as many of the steps of that as possible so that, because sometimes the reason people want to do that is so they can see the data behind that. And if we can just match the client's data behind the scenes, we don't need to have that data in Credible. And then the other reason people do that sometimes is to use, because they want it to create some kind of trigger for the clinician. But we have something called custom alerts that can also work with this. So that was the other thing that I'll have a slide on here in a minute. But basically we're trying to make, one of the things we've been trying to do, and the reason we've been focusing so much on like having these feature Fridays is we're just trying to find places where everyone's doing extra work and try to eliminate that and make it easier for everyone to have access to the thing they need. So that's what this is like if your state uses Point Click Care, we can just solve that problem for you. And then, you can do other things with your time. Anything else you want to say about how it works, Andrew? It's all secure, right? So an SFTP or an FTP is a secure site that data is going to. We're pulling it securely into your secure Janet. And then if it goes into Power BI, it's going over the secure Janet or the Power BI data gateway. So secure all the way around. And same with any kind of Power BI report where you could set up security then on that report about who gets to see it. Yeah, in fact, because it'd be hooked up to your Credible data, you could technically apply the same security settings that you have in Credible, right? Because you could use the Credible row level security match that we have.
Yes.
See
Yes.
our row level security feature Friday, where then it would show the same clients to the same people that would be allowed to see them in Credible as well. So
Exactly right. Yeah.
cool. Okay. Just if you guys have questions as we go, please feel free to put them in the chat. We wanted to share some examples of some different visualizations then that you can do in Power BI based off of this data, right? So some agencies, this is an example of some data people were using to look at people who needed follow-up after hospitalization. So they were looking at people who had discharge dates and then looking at people who were still within like a 7-day window of needing a discharge, but then also looking at data over time and by, number of times people were in the hospital, different facilities and things like that. Do you want to talk about this one, Andrew?
Yeah, sure. Yeah. This is the dashboard that is all of these pages that you see, but this particular one too is based off of the data model that we've built specifically to plug into point-click care. And so it's designed to be almost plug and play. There's going to be some work involved on getting the data right exactly to the point, but like it's mostly plug and play. And the idea behind this is to give you the ability on this page, the ability to look at your ER admits, and you can see those 3 donut charts on the bottom. I love doing this. This is a strategy I do with every dashboard now that I build is you have 3 donut charts. The drop down above the donut chart gives you the ability to select different pieces of information about your clients, whether it's information that point-click care has given us or it's information that Credible has given us because we're able to link those records. And because that data is linked and because each of those drop downs has like, let's say maybe a half dozen different options that you could pick, you can actually, and because Power BI lets you like interact with visualizations, like let other visualizations interact with others, you can pick one, let's say like age group, and then over in the middle, you could pick, say, like enrollment facility. So what facility what facility were they admitted to? And you can actually interact with the 2 of them. So you can click on the blue age group, which I can't really see, but let's call it like, or you can click on like, let's say like, oh, they're 21 to 30, right? And then it will automatically update the middle donut to tell you how many people who were 21 to 30 were admitted to which facilities, right? So, and because you have 3 of those, and because you have all those different data points, it gives you like this almost not unlimited, but a pretty awesome ability to answer most questions about, demographic style information that you might need, any number of combinations of things. And I can keep going, but like that's my favorite part of this particular page. And then of course the raw data is up on the top because it's giving you each individual admit and when they were discharged and how long they stayed.
Nice. Thanks, Andrew. Yeah, and for those of you who build your own Power BI reports, that what Andrew's describing there is like parameters, right? Like field level parameters that you can use to make one chart do many charts. If you're still kind of new to how that works, it's pretty cool. And then how about this page, Andrew? I love this page because this is the other thing that's tricky.
Yeah. So this page and this we are lucky that in both states that we've worked with to pull point-click care data, the contract has included, like the data reporting has included the diagnoses that were provided by the prescriber, by the medical professional in the ER at the time of admit, which is really cool because we can actually then give you a breakdown of the kinds of reasons people who are in your care are going to the ER. We've linked it up with our own data set that I will give Ginger and Crystal a lot of credit for developing. And you should talk about it in a minute, Ginger, but like but we're able to link it up with that, which actually kind of adds additional information and categories to diagnoses. And I'll let Ginger speak a little bit more on that.
I think it's that whole problem where like we say we want to see data by diagnosis, but we don't really mean like, depression, major depressive disorder in remission, major depressive disorder, first episode, major depressive disorder, like we don't really want like 15 different categories of major depressive disorder. We just want to like, how many people had depression? How many people had anxiety, right? And so Crystal, who during the year that she was here as an intern, we worked on taking all the ICD-10 diagnoses and basically using some resources online to kind of categorize those into buckets so that it would be easier to actually like get information by diagnosis. So then Andrew took that data and incorporated it into this. We can do that also, by the way, with data just straight out of Credible, but
Yes.
especially with this data because it can be pretty messy, the set of diagnosis codes you get. So I think your code, Andrew, like scans it. Because if I look at some of these examples, right, you can see it right here, right? Like I didn't actually mean to do that, but it literally has the major depressive disorder example there, right? So there's one called, major depressive disorder recurrent unspecified, and one called major depressive disorder single episode unspecified. But like you kind of really just want to know like how many people went to the ER with a mood disorder, and those are both just a mood disorder. And so it's just like you can easily just look at like everybody with a mood disorder, not everybody with the 5,000 different things that an ICD-10 code can be. So I think that's also helpful because I know sometimes people can find it really overwhelming when there's multiple diagnoses listed as like part of a presenting problem. So anyway, I think those, and then we also tried to go through and pick up ones where it was like technically not a mental health diagnosis, but it would be like related to a mental health diagnosis. So we tried to capture some of those things too. It's always, room to improve, I'm sure, but basically trying to, again, make it so the data is more usable for you guys. So yeah.
And the other thing that we did that like isn't obvious in this dashboard, but it is for those of you who've looked at your own point-click-care data sets, is that the diagnoses, it's great that we get the point-click-care. They also they happen to come over in a very messy, unformatted way. And our system will automatically parse that out. So like if you're looking at this and thinking, well, that's great, Andrew, but like my data doesn't look like this. No one's data looks like this. And like that's our job, is to turn that into something that looks nice. So we already have that in place. So if you're used to seeing very ugly looking lists of diagnoses from your ER ED admits, then just know that so are we. And this
Right.
is the sheet makes it
Yeah,
look
because
good.
actually that's what I was expecting actually when I was looking at this, Andrew. I'm like, but I usually see it say like, F3 2.9 major depressive disorder, and then the next diagnosis is just listed right after it in one big long string, like
Yes.
and
Yeah,
stomach
like
ache and bee sting
yes.
and
Yeah. Sometimes they don't have ICD-10 codes. Sometimes sometimes it's a semicolon that separates them. Sometimes it's a comma. It just depends on whatever. I don't know. Actually, I genuinely don't know what it depends on. But what's important is like we have, as we've encountered new situations for how the data is organized, we've just adapted and we've set it up to kind of to learn and to be that much more smarter.
Great.
That much more smarter.
Awesome. So yeah, and so Andrew's kind of said this quickly, but just to be clear, so if you are an agency that uses point-click care and you did this process with us where you did this email and got this data out, like we basically have these reports, like all these pages of this report, and this page is one of them, basically set up to kind of just work so that you could just start seeing your data in a more organized way. And then you can also think about how else you want to use that data. But we're really trying to make more of these features like kind of plug and play, which is what Andrew's really been working hard on. So even if you're not sure how you would use that data right this minute, like having that work is like something we would be happy to help you guys set up doing. So, because we think this data is really important, and it's actually like I'm pretty passionate about, I don't know. I worked with, my favorite time I worked on a project around point-click care was with this lady who worked at a substance use disorder treatment program. And she was talking about how when, they were doing a medication-assisted treatment, now it's not called that anymore. It's not called medication-assisted. What's it called? Medication.
Yeah, MAT, medicated.
No, I think now it has a different name.
Oh, it does. Okay.
Anyway, does someone know what the new name is? Anyway, please someone correct me. But anyway, the point being that she could see that there were clients who were receiving medication assisted treatment who were still going to the ER for like overdoses. And so she was like saying that like this showed that like that if they were ignoring this information, they were really not providing the level of care they wanted to provide to the folks they treated. And so she was really passionate about it. So anyway, things like that really tug on my heartstrings too. So yeah. Oh, Tegan has a question. Will there be a new table for this data in Janet for on-prem users? So if you were trying to do this on-prem, that will be a little bit trickier, Andrew. What would you say about that?
A bunch of this probably falls into the same category as several other features that we have where we can't really make it work on-prem, but there's not there. You still have good news, and that's that like there's nothing stopping you from letting us run this in our cloud and your own, Janet Cloud infrastructure, like whether you are on-prem now or in the cloud now, like, or even if you are on-prem now, rather, like you still have access to our Janet Cloud at no additional cost. So from like the way that I would implement this, if somebody came to me and said, hey, we're on-prem, but we want this, is we would start up a Janet Cloud for you, and we would configure point-click care on that Janet Cloud specifically for you. And then that would just pull all the information together and power the dashboard.
And then if you wanted to write your own dashboards on it, we can publish that as a Janet Cloud table, which
Yes.
you can then build dashboards on in Power BI. If you wanted that data to be pulled into your own database, we could set up a way that you could get a backup of that data
Yes.
and pull it yourself over SFTP. So even though we'd be like the conduit for the data through our cloud, you could still get the data, and you could then use that in your data too. So
Absolutely.
yeah, so there are pathways for that. Okay, so we went over these examples. This brings me to the next point, which is that the cool thing is, because we're doing all these other things, these all kind of work together, right? So we've talked about custom alerts, which is where, based on any rule you can write, we can send an alert out to your clinicians using an email. And so this data too could be part of what generates an alert. So if like what you want is people to get an email alert, if a client that they're assigned to has an ED visit through your point-click care data, then we can help you set that up, and that can be an alert. This can also be a Janet Cloud table where we can publish it out to your Power BI so that you can write your own Power BI reports. And I want to always give a plug for whole person outcomes, because this same data can also hook up to whole person outcomes data. So you could kind of keep track of people's WHO5 scores compared to their ED visits. You could, that's another way that people often will respond to an outreach in a way, like more and more. We actually just implemented whole person outcomes with another agency, where they noticed it was the clients who were the most difficult to engage who were actually answering the survey. So it's kind of interesting that that's a way to engage people, even if they're maybe a little bit difficult to engage in other ways. So the cool thing about this new source of data is it integrates with all these other things we can do with the data. It's kind of as if you're bringing it into Credible, except you're bringing it into something that can do all these things. What else would you say about that, Andrew?
I think that you said a lot. The thing I would add to custom alerts is like that's a great example, but also the cool thing I think about custom alerts is that really it's like as flexible as you need it to be. So, I mean, if you want to be alerted only on Tuesdays when somebody was admitted to the ER and was given a very specific diagnosis, sure, we've got that. Like we can make that happen too. It's super flexible.
Yeah. Or if you just wanted to know people who had been to the ER who didn't have a follow-up appointment scheduled.
Sure. Oh yeah, that's a great one. Yeah, that one makes more sense than Tuesdays.
Yeah. So we've thought about a lot of applications. We're interested what you guys think about applications too. There's all this stuff about identifying trends, patterns of services, changes in seasons, things that might indicate a higher risk for hospitalization. There's things around diagnostic mix. So like, what are common co-occurring conditions that could be addressed, or things you could go for grant funding for, or work on building community partnerships, proactive planning for people so that, I've even thought about like there is this way where you can upload a crisis plan to someone into point-click care. But if you started doing that, it would be interesting to see like, you'd be able to tell, because maybe their crisis plan would also be documented in Credible. So you could have a report that's like, show me all the clients who have crisis plans in Credible, and then show me people who went to the ER, and like compare whether folks with crisis plans are going to the ER more or less, or, are you targeting the right population with who you're uploading those for? And then population health. So like, I just think there's a lot. That's one of the things that is often overwhelming for people about the point-click care data. It's often described as a fire hose, because you serve a lot of folks, and often some agencies are like the designated service provider, even for clients that they may or may not actually have a service relationship with. So it's like, if a client had, let's say, Medicaid, and in your state, Medicaid clients who live in a certain county are assigned to you, you might be getting data about clients you've never met or seen. But I think that can be overwhelming, but it does give you like a more of a big picture of the population of folks in your community and also the population of folks you serve. And I think there's an opportunity there in terms of like, you know, we talk a lot about value-based payment and about like, how do we show the value of the services we provide? And we talk about whole person health and about how improving someone's mental health decreases their physical health issues as well, or vice versa. But I think this is where like possibly there's real data that could support that, right? Like, you know, if someone is having a lot of health issues and that's why they're going to the hospital, if we like, sure, it's not really our wheelhouse, but also like helping them improve their mental health might improve those health issues too. So that's kind of, you know, one of the reasons sometimes that insurance companies are kind of interested in mental health is not so much the cost of mental health services, unfortunately, because they tend to be underfunded, but it's actually because the folks who get mental health services cost them a lot of money on the physical health side. And so one way to think about this data, even though it is a lot, is that like there's an opportunity there, I think, for us to demonstrate the value of the services that are provided in mental health and SUD. So, yeah. Okay, I have some questions for you guys. Based on what you've learned today, how likely are you to follow up on using this information in more ways? Look, you only get to pick one. You either have to be very likely, somewhat unlikely, or very unlikely. I didn't even give you a neutral. And then what seems like, this would be really helpful to know though, what seems like the biggest barrier to moving forward for you and your agency? Would it be like finding the right person to contact at Point Click Care, figuring out the structure of your relationship at Point Click Care, getting the data integrated into your existing structure, helping your team understand how it could be beneficial, or is there something else that would kind of get in the way? And I just want to point out, like Andrew said, number 2 here, the figuring out the structure of your relationship with Point Click Care, like as Andrew said, like our recommendation would be to just try it. Like the worst thing they can do is just say like, oh no, you don't have the right kind of license to be able to do that. But I'm not sure that they always know. So just ask, like it doesn't hurt to ask. So we certainly haven't had anybody get in trouble for asking. So I think, you know, for us, we just want you guys to have what you need. And again, even if you're not 100% sure yet exactly how you might use it, I think the likelihood you would find usefulness of it is pretty high. So yeah, but Melody, I know you're on-prem, but we could do it. We could get it hooked up on our cloud and hook it into you guys. So
yeah, absolutely.
we should talk about it. Yeah. The only reason, and the reason we're doing that is the reason for our like wanting this to be in our cloud is that's how all of this plug and play stuff is built out, right? That's the way that we can really deliver that really low barrier. So we should talk, Melody, because we could do that for you. All right. Well, thanks you guys. Okay. Thanks for filling out the poll. It looks like some people are likely, some people are not likely. That's okay. If there's anything else that's getting in your way, please let me know. It looks like getting the data integrated into your existing data structures is something people are thinking about. We're certainly happy to help with that. But yeah, basically, you know, this is our first foray basically into like kind of, well, technically Point Click Care is an HIE, right? It's a form of a health information exchange. So, you know, we're excited about it. If there are other types of information exchanges you are interested in getting data from, we're excited to do that too. So keep us in mind and let us know if you know who we should talk to about that. But yeah, we're really excited about it. I think this is one of those things that we wanted to really highlight, because if you don't know we can do it, it's one of those things you might not even realize would be useful, but the people who are using this are really excited about it and really finding it useful. So we would love to hook you guys up with it too. Okay, now you get a whole bunch of, oh, this is a little outdated because we've already had we've already had all of these. We do have upcoming events, but they're not on this slide. Sorry about that. So we'll, but I'm trying to think what our next event is. I don't have it in the top of my head. We did 2 this week, so I'm a little behind, but I think I know we have a guest speaker coming up. Yeah, we have some guest speakers coming up. So check out our community for more about that. Just a reminder about, you guys all know what we do. We do Janet, we do consulting services. We care about you guys having the stuff you need. And that's my contact information. Yeah, does anyone have any questions, any thoughts? What else would you say, Andrew? What did I
I mean,
miss?
I look forward to working with folks. It's been a lot of fun and interesting, especially interesting to see, you know, how agencies across the country, because it's two opposite sides of the country, you know, use this data. And I look forward to adding your agency to my list of experiences.
Yeah, so the states we know are using point and click care now are Virginia, Oregon, Washington, and Minnesota, I think is about to. Oh, Tegan asked, can you grab the email template from the slideshow once it's posted? Yeah. In fact, Tegan, if you want, I can send you, oh, thanks, Katie. Minnesota is, yeah. I can, Tegan, or anyone, those of you, I think everyone who's here mostly is working with us. So I'm happy to send you the actual names of the people too. I didn't want to post those in our like public slide deck because I felt bad in case those people were like, apparently we got called out in some webinar and everyone's contacting us. So I didn't want to do that to them. But yeah, Tegan, I can follow up with the whole little instruction packet, in fact. So yeah. Yeah. Well, thanks everybody for coming today. Happy Friday. Andrew, thanks so much for all your work on this. I think it's great that we're able to offer things like this, and I'm excited for the things we'll be doing going forward. And as more of you are using this, we'll have more examples of things you're using it for, and that'll be exciting. So yeah. Cool. Okay. All right. Well, thanks everybody. We will see you soon. Have a great weekend. We'll talk soon.
Bye.
Okay, thanks. And thanks, Andrew. Bye.